Thank you. So good morning. My name is Perez Musyoki, as introduced. I work with University of Nairobi, USID Fare Jamii Project as HTS and prevention lead for the program. And I'll be taking you through an abstract on improving access to HTS and prevention services among adolescents and young persons, AYPs, 15 to 24 years through the social network strategy in Kajiado County, Kenya. And I'll begin with a brief background. And is that despite significant global strides in reducing new HIV infections, HIV incidence remains unacceptably high among AYPs in sub-Saharan Africa. And here in Kenya, AYPs account for 52% of all new HIV infections, and hence they need to adopt more evidence-informed testing strategies targeting them. And SNS is one key promising modality for reaching AYP peers and networks who share similar HIV risk behaviors. And just a brief definition of what this SNS is. And SNS stands for Social Network Strategy. And this is a recruitment strategy for reaching and providing HIV testing and referral services to persons who are unaware of the HIV infection by using their at-risk social network connections. So in this abstract, we sought to describe the effect of the SNS strategy on identification of AYPs living with HIV in Kajiado County, Kenya. Looking at the methodology, and is that between October 2023 to May 2024, Fare Jamii Project in collaboration with Kajiado County Department of Health implemented the SNS among AYPs at 34 health facilities, supported health facilities. So the AYPs were screened by HTS providers within the various facilities we support using the standard SNS screening tool. And those at high risk offered HTS and subsequently recruited as seeds, or recruiters for SNS. So the HTS providers offered the recruiters instructions and coached them, on the entire SNS recruitment process. And they also gave them referral coupons, which we'll look at in the next slide, which they would use to invite, their fellow peers, whom would be locally, referred to as bogi, whom the Gen Zs, anguka nayo with, these social hotspot joints, these house parties, road trips, and so forth. Who they felt they were at an elevated risk of HIV acquisition. So we conducted a retrospective review of the data and performed descriptive analysis. And this is our SNS implementation path. And the first stage, first phase entails initial recruiter identification. And this recruiter, or the guys we are calling seeds, can either be iris negative or positive. So phase 2 includes recruiter coaching, or what we saw in the previous slide, or recruiter instruction. And then phase 3 is about recruitment of peers using SNS referral coupons. And then finally testing of these peers and eventually inviting them to become a recruiter. And the pathway, continues as it is. And the slide on the diagram on your left is basically a sample of the SNS referral coupon we use, and this coupon is what the peer would come with in the facility and present, and the coupon indicates is a size of an ATM card, just a simple card, indicates that this coupon allows you to receive the following services. At any of our facilities, free of charge. So including HIV testing, free TB screening services, free lubricants, free exposure prophylaxis, free PrEP, free STI screening, free NCD screenings, BP measurement, height, weight, BMI measurement, and so forth. And of course, this serves as really an monetary incentive, and as something to motivate and entice peers to come to the facility, even looking at, in the context of sustainability. And our underlying assumption and principle in these strategies is that AYP peers in the same social networks share similar risk behaviors for HIV and are more likely to trust each other and respond positively to HIV testing messages from fellow peers whom they know. So looking at the results, so between that period, we engaged a total of 219 AYP seeds. Our recruiters who referred 63 peers for HIV testing services. A recruiter to peer ratio of 1 is to 3. So 96% of those referred, that is 608 of them, were eligible for testing, out of whom 571 received an HIV test, a testing rate of 94%. So we managed to identify that 4 AYPs as who were newly diagnosed with HIV. That is a 6% positivity yield. So this was actually a 4.3% increase from the overall yield of 1.7 obtained from the other testing modalities, across the other various service delivery points within the facilities. Good enough was that 4 of them, 100% were successfully linked to ART, while the remaining, 89% of those who tested negative were enrolled on PrEP, with the remaining negatives linked to other appropriate prevention interventions. And this is just a graphical representation of the results. You can see the yield from all modalities, 1.7%. From SNS, a yield of 6%. And all were linked to treatment, and 89% of them were linked to PrEP. So in conclusion, the SNS strategy, as we have seen from the results, was actually 3.5 times more effective in identifying AYPs living with HIV compared with the other conventional HTS modalities, and therefore every effort should be made towards scaling up SNS among the AYPs as a high-yielding modality and approach for case finding, as well as for entry to prevention services. And this is key in averting new HIV infections among the AYPs in efforts towards ending the AIDS epidemic as a public health threat by 2030. So I would wish to acknowledge the following: the Minister of Health Kenya, through NASCOP, Kajiado County Department of Health, University of Nairobi USID Faria Jamii Program, Facility HTS teams, peer educators, the AYP community, and the OTZ champions. Thank you very much.